Doctors, what was the wildest self-diagnosis a patient was actually right about? I knew my partner had leukemia about a week before I could convince him to go to the doctor. He was bleeding and bruising really easily and had petechia. I wanted to go to the urgent care where I knew the CBC was done quickly on site, but he instead wanted to wait to go to his primary. I took him to his primary and had a bag packed for the hospital in the trunk. I told him it was likely a B12 deficiency, but that he'd do blood work to put my mind at ease anyway. I asked if the CBC was done on site or not, and he said it was sent out. I asked if he planned to rush the CBC. He got very angry and said, quote, "There's nothing the CBC could show that would change my treatment plan." Then he told my partner he needed to stop me from Googling. We got a call that night from the lab that his WBCs were dangerously high and platelets were dangerously low, and I had to immediately take him to the ER. I did, and he was diagnosed with acute leukemia. Story 2. One of my dearest friends from middle school is suffering from absolutely devastating medical issues. She went from bright and thriving in university to having to drop out before she graduated because her health bottomed out. She lost her job that paid her a fantastic amount. Basically, her entire life fell apart. She was telling me about the new weird thing happening to her, some strange anemia that was found to be the result of abnormally low ferritin in her blood, which is what enables your red blood cells to carry iron. That was when something clicked in my brain. Horrible digestive issues, peculiar anemia, chronic infections in her spleen that required splenectomy, would sunburn to a blistering point in less than half an hour, a diagnosed allergy to sulfa drugs, horrible reactions to carbamazepine. Retinol gave her a separating skin rash. I'm a pre-med dropout, and one of the first classes I took on my path to pre-med was an undergrad course in rare conditions and diseases. And one of the ones we discussed in our inherited disorders segment of class was porphyria. There's an easy way to tell if someone has porphyria. Have them pee into a clear plastic or glass cup and expose it to direct sunlight. In a period of hours to days, the urine of people with porphyria will turn from clear or yellow to a wine red or wine purple. So I asked her if she trusted me enough to do something weird, told her to get a clear plastic disposable cup from her kitchen, pee in it, and put it on her windowsill where nobody could see it. And if anything about it changed, come tell me. Approximately 4 hours later, she called me on the phone, screaming that her piss turned effing purple red like a goddamn vampire, and I told her she needed to go to the doctor and get it tested for porphyria. 2 weeks later, she tagged me on Facebook calling me lesbian Dr. House because she was diagnosed with CEP. Edit. For everyone saying I stole this from Scrubs, I didn't even know Scrubs had a porphyria episode, so I looked it up, and it came out a full year after this happened. Also, watching Scrubs and giving someone a DX doesn't cost you $100,000 that you end up having to pay back for 20 years. Story 3. EM/ICU doc here with over 10 years of experience. While it's not quite a diagnosis, experience has taught me to take very seriously when a patient states he's about to die, even if he appears in a stable/controlled condition. Patients who have a life-threatening condition usually have a premonition about their imminent decompensation, which is usually preceded by very subtle signs of worsening that may be confounded with pretty much anything that happens on a resuscitation room or on the back of an ambulance. I've had patients who appear to be in a completely stable condition, with acute conditions where cardiac arrest was not foreseeable. Example, motorcycle accident with single limb injury, who briefly mention they think they're about to die before suddenly entering in cardiac arrest due to a malignant arrhythmia. It's believed that patients may perceive a sudden drop of blood pressure and or the usual release and spike of adrenaline and other catecholamines as imminent death, but the reason why this happens is not clear. Some we're able to return, others we lose or recover them to a state where death would be better. Story 4. I'm not a doctor, but this is what happened when my son self-diagnosed correctly. 3 years ago, he developed a terrible earache and went to urgent care, where they told him he had an ear infection and gave him an antibiotic. The pain intensified over the next day or so he returned and was told he should make an appointment with an ENT, but because it was the weekend, no ENT offices were open. so he had to wait until Monday. In the meantime, his ear started draining and he saw what looked like spores in the fluid, which would indicate a fungal infection. He's a naturalist and knows what spores look like. The pain grew so intense that he ended up going to the ER. He told the doctor who examined him that he had seen spores in the drainage from his ear and suspected that he had a fungal infection. He later heard the doctor talking to a nurse in the hallway, laughing and saying he thinks he saw spores. The doctor prescribed another antibiotic and a steroid. The next day, he flew home to see us for Thanksgiving. I don't know how he managed the flight, because as soon as he got here, he curled up on the floor howling in pain. I immediately called ENT offices all over town, but most were closed for Thanksgiving week and said they could not see him. Finally, one scheduler took pity on him and said she would move things around to get him in. A PA examined him and confirmed it was a fungal infection. She told him that the steroid he had been prescribed by the ER doctor was the same agent used in the laboratory to culture fungal infections. His infection had started to enter the eardrum and from there could have spread to his brain and killed him. She gave him a prescription that cleared up the infection very quickly. The wrong diagnoses at urgent care in the ER cost him over $1,500 out of pocket and several days of excruciating pain. The ENT's office did not take his insurance, but charged him only $250 for the correct diagnosis. Story 5. Patient here. I had a work accident, opened the roll-up door on my delivery truck and the load of tires fell, hitting my shoulder and neck. Couple days later, I started having fainting spells and my arm became swollen and discolored. Lots of neck and shoulder pain. Lots of doctors, lots of tests, lots of specialists, no diagnosis. I came up with the solution. I tore the anterior scaling muscle. As it healed, it compressed the subclavian artery and nerve that go to the arm. Key to this explaining the swollen arm was a quirk of anatomy. The artery was compressed between where the carotid and vertebral arteries branched off. The carotid fed my brain, but normal flow to the vertebral was cut off. So my body did a weird thing. It reversed the blood flow, pulling blood out of the circle of Willis, a loop of blood vessels in the brain. That was the only blood feeding my arm for several months. A Doppler ultrasound confirmed thoracic outlet syndrome with a subclavian steel retrograde blood flow in the vertebral artery. Okay, full disclosure to the listeners today, I don't know what the hell any of these people are talking about. All these medical terms, I'm trying my best to pronounce them and keep the read steady. I apologize if you know what they're talking about and I'm butchering them. Just wanted to throw that out there before we continue because it's clear that I'm going to have lots more medical jargon to unpack here. Story 6. Patient here. Was through hiking the Appalachian Trail and was in Southern Virginia near Roanoke. Was having a fine day until I went to pee in my motel room. Straight blood. Also, had been getting weird spots and sores on my legs that didn't go above my waist or below my ankles. ER doctors, 3 of them, all stated that it was a tick-borne illness, considering I had been hiking for a month in the woods. Rocky Mountain spotted fever, probably. But I had that in college and knew it wasn't it. I told the 4th ER doctor who came in that based on my Googling, I had Henoch-Schwallen purpura, an autoimmune disorder that's very rare in adults. She agreed, sent me to Virginia Tech for a biopsy, and they confirmed vasculitis. Went on to get arthritic pain in my knees and several abdominal pains. Went for an ultrasound and discovered I had underlying autosomal dominant polycystic kidney disease that after testing, I did not inherit from my parents. Doctors began talking to me like I should be in a textbook. 7 years later, I'm symptom-free and just taking a small dose of blood pressure meds, but felt like I was on house for a few months there. Story 7. Patient here. My story is just a long and dumb story. I kept getting migraines more and more often. I started getting nosebleeds and blacking out at the gym. Then, one day after the gym, the migraine never stopped, so I went to my doctor, who gave me a Toradol shot. That didn't work, so he sent me to the ER. It's sinusitis. Go buy a humidifier. I did. The migraine didn't go away, and I could hear my heartbeat too, so I made an appointment with an ENT. They ordered an MRI, and when they saw the results, told me to see a neuro ASAP. They couldn't help me see one, couldn't write a referral or anything, but I needed one as soon as humanly possible. So I called my GP. They sent referrals to every neuro in my area. I called 13 offices, made 13 appointments, and got put on 13 wait lists. I saw neuro 2 days later, then called the other 12 back to cancel. Neuro was like, the MRI shows signs you might have too much cerebral spinal fluid in your brain, but MRIs don't actually see CSF, so all we can see is the side effects, thinning of the bone from the pressure wearing away at it. Your pituitary gland is flattened, etc. We need to do an MRV and lumbar puncture to see what's actually happening with the cerebral spinal fluid. So we do that, and the pressure in my head is 40 when it should be 50 to 15. Cool. She puts me on meds to lower my CSF production. Okay. The pain does not change. She doesn't know why. So this neuro, because I was just trying to see any neuro, was a sleep specialist. I decided to change to a headache specialist for more specialized care. He changes the types of meds I'm on, but the pain basically is still agony. I ask him, hey, so I read birth control can trigger this. Should I take my IUD out? He's like, no, you should leave it in. It's stabilizing your hormones so your periods don't make things worse. I listen to him for a few months. Then I say F it and have it removed. The pain dropped significantly within 3 days of removal. Then I'm like, what the F? My ability to think clearly is not great. But I pull up my MRI and MRV reports and start reading them and doing research on what it all means. Transverse sinus stenosis. A cerebral spinal fluid vein was collapsed inside my head. So I went to my neuro and was like, hey, isn't this important? Shouldn't we have to fix this? Neuro says, no, ignore that. So then I went to see a neuro-ophthalmologist. He was like, your eyes are fine, so your brain is fine. What you're feeling is a migraine. The meds are working. Go back to neuro. I was like, what the F? So I went to a different neuro. Me. I want a stent. Neuro's like, huh? Looks up things on the computer. Oh, you do have a stenosis. I'm not really a vein doctor. You need a stroke specialist. Let me refer you. Stroke specialist says, MRVs suck at showing you how bad a stenosis is. You need a neurosurgeon to go in there and take a look at it. Neurosurgeon says, yeah, let's go take a look. So the neurosurgeon did an angiogram, exploratory surgery, and saw that the pressure in my head was still 40 after 2 years on the highest dosage of pressure-lowering medication, and I qualified for a stent to fix the vein. I was right. The pile of my previous doctors were wrong. I had to keep changing doctors and believe that the vein was the issues, and all my doctors were idiots until I finally got help. There's more dumb stuff that's happened over the last 5 years, but that's the major stuff. Yeah, this has to be aggravating to have these doctors basically just treat you like a lab experiment and not a living, breathing human being is very, very off-putting. And also, someone who gets chronic migraines myself, I can't imagine dealing with double that level of pain for 2 to 5 consecutive years. Bless you, OP. I hope you're doing better. Story 8. Another patient here. Wasn't wild for me, but apparently for my doctor. To set the scene, my mom has AS. My great-grandpa had it. My grandpa isn't diagnosed, but has a few symptoms. I was tested positive for the HLA-B27 gene as a toddler and grew up seeing my mom's symptoms and sometimes assisting her. At 19 or something, I started getting mild pains that got worse in some situations. After some time, I went to an orthopedist near my house. Easier to get an appointment and closer by than a rheumatologist. I served the whole thing on a silver platter for him. My mom has AS, I have the gene that makes it more likely, didn't know the name of the gene by heart back then. I'm having pains in a joint that my mom has had a lot of trouble with as well. In short, I think it's AS. The doctor straight up told me, yeah, no way, there's no such gene. Your joint is just blocked. Tried to painfully unblock it to no avail and wanted to get me to accept some kind of shot into it. Not being a fan of needles, I declined that one, and decided to eat the waiting time and the longer drive to the rheumatologist instead. Surprise, surprise. I was right, and I have AS. Exactly what I served on a silver platter to that idiot doctor who pretty much declared it impossible. Story 9. Patient here. I've always known I've had something wrong with my heart. I was never taken seriously as a child and a teen by anyone, and the PCPs I saw never did anything more than listen to it for a few seconds and tell me I was fine. I just learned what I could and couldn't do in my daily life to keep it from interfering, and over time sort of left it at the back of my mind. After a series of unrelated medical events over the course of a couple of years, I was aware of my heart getting worse. After much pressure and persistence, I got a referral to a cardiologist who told me to track my vitals on my Apple Watch for a few months and come back to him with the results, as he was off on leave until then. I was a bit bummed. It had taken a lot to get a referral to him, and I was still being brushed off. Then COVID hit, and everything pretty much shut down in my country for 2 years. During that time, the only notable event was being hospitalized for kidney issues after severe gastro that left me so dehydrated I was hallucinating. Just before discharge, I had a doc come around to do his final obs before releasing me. It was a teaching hospital, and he had a gaggle of students with him. He listened to my heart and got excited, and then proceeded to use me to teach said students what an S3 heartbeat sounds like and how to fix it. None of his talk was directed to me, but I listened and I learned. I got myself the best portable ECG Holter type monitor I could afford, and I wore it to take ambulatory EGCs, and then I learned to interpret them. Obviously not to a medical standard, but enough to be able to note the areas of concern, what abnormalities in the waves I'd noted, my BP, and what I'd been doing at the time, physical symptoms, etc. Then I went back to my cardiologist and I told him I had WPW syndrome, and it was getting worse, and he needed to do something before it killed me. He scoffed at me, but I'd been expecting that and handed him pages and pages of relevant EGC recordings and asked him to at least prove me wrong. He looked over the EGCs in my notes, told me he knew medical students who weren't capable of this, which scares me to be honest, ordered his own tests targeted on the info I'd gathered, and not too much later begrudgingly confirmed my diagnosis of WPW. One catheter ablation later, my life is much improved. Stupidest thing is, if I'd been taken seriously at any point prior, it could have been managed with medication, and not done permanent, irreversible damage to my heart. I shouldn't have ever had to learn to read ECGs, nor spend hours on medical sites reading medical journals researching heart conditions. I'm still convinced I'm going to die of a heart attack, but at least it won't be today, or hopefully tomorrow. Story 10. It happened to me as a patient 4 times. On the first occasion, I was 15 and started having bouts of severe abdominal pain and developed irregular periods. My mom took me to the GP so many times and they just kept blowing it off as anxiety or just my period. Got a half-assed diagnosis of it could be endometriosis. Track your periods for 3 months and come back. I kept going to school, etc. because I had no choice, but kept gradually getting sicker. Went to Comic-Con with friends and projectile vomited on the con floor. That was embarrassing as F. I was in intense pain the whole weekend, and when I got home, I went straight to bed. Woke up at 3 a.m. in so much pain I could barely move. Woke my mom up and told her I thought I was dying. Got rushed to the hospital by ambulance, and the first doc we saw said it was constipation. My mom went nuts and demanded a second opinion, and I was admitted for observation. 4 p.m., the new doctor finally sees me and sends me for an immediate scan because I'd gone gray and was barely responsive. The scan showed a massive growth on my ovary and an ovarian torsion, and I was taken to the theater immediately. On the way to theater, I genuinely thought that was it, and I was about to die. I did stop breathing on the table, but obviously I did survive it. Mostly thanks to my mum digging in her heels and fighting for me. She told me at the time she had a gut feeling that if I was sent home, I would have died. And she was right, as by the time I made it to theater, I was already going septic. Mums just know. Second time, I was at uni and had the most blinding pain in my kidneys. It was so bad I collapsed in my uni house kitchen and my roommates had to call an ambulance. I felt like someone was tearing my sides apart, and it was all I could do to not scream continuously. I got given morphine and gas and air in A&E, and my urine test was positive for blood. Was eventually seen by a doctor, and I told him I thought it might have been a kidney stone, as those run in my family. He laughed and said, "You're only 22, you're way too young for that. It's probably a UTI, but we'll do a CT to rule it out." I got the scan, and a few hours later, the same doctor returned and sheepishly told me it was indeed a kidney stone. I was sent home with hefty painkillers and pissed it out 2 days later. Third one, again while at uni. Started feeling unwell during a lecture. By the end of the lecture, I was pale, clammy, and was struggling to stand upright. I had searing pain in my lower right abdomen and just knew it was my appendix. I went to A&E and had blood tests, etc. They came back normal, and I was told it's gastroenteritis and was sent home. Didn't sleep all night and went to my GP the next day. She sent me to the hospital because she didn't like my symptoms. They did blood tests again and they were still normal, but I felt and looked like crap. I asked him if it could be appendicitis and was told no because, quote, if it was, your labs wouldn't be normal. They discharged me again. 7 hours later, I woke up and started puking and couldn't stop. Again, my housemates called an ambulance. This time, the surgeon actually bothered to feel my abdomen as no one had done that, and when he pushed on the painful area and let go, I almost flew off the bed and screamed. He said it might be appendicitis, but it was unlikely, but because of that reaction, he was going to do a laparoscopy and see. Dear reader, it was appendicitis, and the thing burst as they were removing it. A serious complaint went into the hospital after that. The fourth one happened recently. I've had ongoing upper abdominal pain, reflux, and heartburn since February, and it's been slowly getting worse. I've had multiple appointments with the GP, who has been very dismissive, just referring me to specialists and prescribing painkillers. I have EDS, and we're prone to weird crap going on with our organs, so after a few basic scans that didn't show anything, I asked if it could be a hiatus hernia, as I have all the signs including weight loss, lack of appetite, nausea, and difficulty swallowing food. He all but rolled his eyes and said it's unlikely because of my age, but sent me for an endoscopy anyway. I have a hiatus hernia. Not just that, but a particularly rare type where the stomach is actually herniating up into the esophagus. So now I'm waiting to find out what they're going to do about it. All these occasions I've voiced that I just had a gut feeling about it, but I'm always scoffed at or not listened to and then never apologized to when it turns out I'm right. Some doctors let their egos get in the way and could absolutely do with more lessons on actually listening to the patient and not blindly going by the textbook. I'm convinced that when I do eventually kick the bucket, it will be because a doctor didn't take me seriously. I just don't understand dismissing diagnoses because of the age of the patient. Like, you can have a heart attack in your 20s, you can have a stroke in your 30s, you can have kidney stones in your 20s and 30s. It is possible. So, like she said, listen to your patient. That's just ridiculous. Story 11. Another patient, but work in healthcare. I had pain in my right leg, specifically my glute. Progressed to lightning-like pain down my leg, pins and needles. I assumed I had fluid or a mass crushing my sciatic nerve, and after a week of rapidly increasing pain, assumed it was an abscess. So I started feeling septic, went to ER and they refused me, sent me up to the primary ward. They immediately sent me back down to ER and ordered a CT. Lo and behold, I had a 500 milliliter abscess under my muscle crushing my nerves in my right leg. Before my second surgery, my specialist refused to believe they drained that much from me, and I had to show photos for proof. He said, and I quote, "If there had been that much, you'd be in the Guinness Book of World Records." He called in other doctors and nurses to review my photos and case afterwards. Story 12. Hansen's disease. Saw a patient for the first time to establish care. 52-year-old man from Brazil. He came in with his nephew, who was my patient already. He had contractures of the bilateral hands and feet, decreased sensation, and lesions with areas of what appeared to be necrosis. He reported worsening mobility over the past 6 months. He had not had medical care in many years. I saw him, and to me, the lesions looked like a vascular issue, and I suggested I would order testing, but planned to send him urgently to a vascular specialist for an opinion. He said he believed it was leprosy. I told him I thought it was not likely, and pulled up some photos just to show him how unlikely it was. I hesitated when I saw some photos of milder cases and saw that there was actually a close resemblance. I asked if he had any contacts and he said no. I decided it was likely overcaution, but I said I would be sending him to a dermatologist as well to ensure we were being thorough. Well, a couple weeks later, he did in fact get a skin biopsy that was positive for leprosy. To this date, it was one of the rarest and most unlikely diagnoses I've ever seen in 10 years of practice. So once again, if something is unlikely, I think you need to draw a hard line between unlikely and impossible, right? If it's impossible, it's impossible. But unlikely, you still need to check and test for it. And once again, listen to your patient. They're telling you exactly how they feel and you should absolutely take that into consideration. Coming from a non-doctor, of course. Story 13. NAD. Patient here. After enduring chest pain and shortness of breath for 1 week, I went to the emergency department. It took 10 hours to run basic blood work and be told to rest for 3 to 5 days. I revisited hospitals 5 times over the next few weeks as it was getting worse. I was becoming bedridden with fatigue. I could no longer lay flat as I developed pleuritic pain while supine. I saw my PCP and told him, "Hey, someone I know told me that my symptoms match the symptoms they had when they were hospitalized for pericarditis years ago. Could this be pericarditis?" He said no and referred me to pulmonology. 7 months later, I had strings pulled within the referral intake department, and at last I got to see a cardiologist. He diagnosed me with, you guessed it, pericarditis. He prescribed colchicine, which was the first treatment I was provided after 8 months of suffering. More than 3 years since the pain began, and after a few rounds of colchicine plus NSAIDs, I recently had a cardiac MRI. It found past and current inflammation of the pericardium. Newest flare started early October, so I had been on colchicine plus NSAIDs for a month leading up to the scan. So I'm awaiting a rheumatology referral for the next line of treatment. I often wonder if my case would have still turned recurrent if I had been properly diagnosed and treated the first time I went to the hospital, instead of an 8-month delay. Story 14. Nurse here. I actually diagnosed myself with epilepsy as a teenager after having simple focal seizures multiple times a week for years. Around the age of 14, I started having frequent episodes of what felt like deja vu. I would get hot, my hands would tingle, I felt lightheaded and nauseous, and then I would have the sensation of almost daydreaming, but it was like an involuntary vision inside my head. It would last around 10 to 30 seconds. I would always feel anxious and have a lot of brain fog that day, and sometimes I'd get migraines and severe fatigue after. Anytime I would Google my symptoms, the Epilepsy Foundation would pop up, but I just brushed that off because I only knew of seizures as grand mal seizures with loss of consciousness and shaking. When I became a nurse years later, I learned about all the other seizure types and really started questioning my symptoms. I pretty much accepted my symptoms were most likely some form of focal seizures and that I probably had epilepsy that was being triggered by my menstrual cycle since they started when I first got my cycle. I unfortunately was very hesitant about seeking treatment since I never lost consciousness and I didn't have any obvious triggers like lights, etc. So I felt like no one would believe me. I mean, I could have a spell while holding a conversation and no one in the room would notice anything, other than some minor skin flushing. All my symptoms were internal, so it was very easy to second guess myself and wonder if I'm just having a deja vu or anxiety. Well, one night I was working a shift at a hospital and I felt a seizure coming on while in a patient's room. It felt much stronger than usual, so I went to sit down and unfortunately, I instead fell to the floor unconscious and had a grand mal seizure in my poor little old lady's hospital room. I woke up confused, unable to speak properly, with a bloody bruised tongue and my shoes in 2 different corners of the room. I was rolled down to the ED and after some testing and a neuro consult, I was formally diagnosed with catamenial epilepsy with simple partial temporal lobe seizures. I'm now thankfully controlled with medications and seizure-free. I'm ashamed at how long I let myself go without treatment due to the fear of being wrong about my self-diagnosis or not being believed. Story 15. This was from a few years ago. I was out of town at a conference, about an 8-hour drive, and started feeling flu-like symptoms. Febrile, severe muscle aches, extreme fatigue, but it was June, not flu season. Went to a doc in the box and got, surprise, a Z-Pack. Kept getting worse and I needed to go to an ED. My spouse is an MD, so I said okay. I'm usually the one that waits things out. Through some heroic efforts, we made it home, went straight to the hospital. I'm a quite fair white person, but I was pretty much white. My BP was in the 70s, kidneys starting to shut down, CT scan of abdomen showed nothing. They were suspecting E. coli, but that didn't make sense, no GI issues. Really, no one had any idea what was going on. Admitted me and started broad-spectrum antibiotics. After one night, I wasn't getting better, so off to the unit I go. After 3 days in the ICU and 2 more nights on the floor, I finally went home. At that time, there was still really no DX. But Dr. Penhelnick figured it out. Spouse is a dermatologist, although also boarded in medicine. Got hold of all my labs and called the health department in the state where I'd been. We were able to have acute and convalescent phase IgG, which confirmed Rocky Mountain spotted fever. Fortunately, one of the antibiotics I got was doxycycline, which is the recommended one. So the PT's, dermatologist, spouse figured it out. Too crashed to perfuse enough red cells. No memory of tick bite, no sight of a bite found. No being in the woods, but I have never felt worse in my life. I fecking hate ticks. Story 16. Biggest thing I can say from a provider standpoint is that the increasing work demand, with less time to do it, with increased accessibility to patients sending in mobile messages via the portal, etc., makes it more difficult to get accurate diagnoses. I frequently have patients writing in that want to change treatment, or have labs drawn, etc., and I just want them to come in for an appointment first. It's amazing how often they're convinced it's one medicine causing a side effect, when another one they're on is known to cause the issue, or how the labs they wanted wouldn't actually help diagnose what they're looking for. I believe in patient intuition, and although I genuinely can't think of a good example of someone diagnosing themselves, I do like to ask what they think is going on, or what their goal is, because otherwise we can end up on two wildly different paths. Sometimes I do find that the same patient coming back and explaining the same symptoms another day will lead me to a totally different conclusion. Maybe that's because our first try didn't work. Maybe they just said the right thing at that time, or maybe my plate wasn't overflowing that day. Either way, I'm never upset when a specialist finds something I missed, etc. I'm just happy a patient gets answers. Story 17. Medical physicist here. One day, went out for drinks with friends. Friend of a friend gets a call and the dude walks out to take it. Comes back a little bit shaken. We ask what's wrong. He says a buddy of his is having a hard time because he adamantly believes something is wrong with his brain. No one takes him seriously. No MRI, no CT. My guess, because those exams are very expensive here. Doctors just prescribe normal medication that isn't working. The one friend who knows what I do looks at me and I just say, trust your doctor. Guy says that he does, but his friend has been feeling like crap for months and getting desperate. Tells me a little bit more of what's happening. All he wants is an MRI to have some peace of mind. I say, I got you. I have unrestricted access to a state-of-the-art MRI used exclusively for research, but we can have volunteers, usually healthy people to use as control for our experiments. I pull up the volunteer form on my phone and send it to him. I tell him, have your friend fill this anonymous form and send it to this email. I'll schedule a volunteer screening for next week. I'm the one who picks volunteers. On his favorite food, have him write warm ice cream, so I make sure he's in. There will be more volunteers. In no circumstance is he to let any hint that he knows who I am or why he's there, or he might be discarded as a volunteer by my supervisor. Every MRI is looked over by specialists just in case, and we contact the volunteer with his MRI and the specialist's annotations for them to take to their doctor. If anything is wrong, the specialist will contact him. It happens very rarely, but it happens. That week comes and goes. Sure enough, one of the volunteers had an issue that needed attention. I had no idea of the specifics because of the data protection and confidentiality. No idea if it was that dude or not. Next week after, my friend calls me. Friend of a friend of a friend, actually. Had a mass in his brain and was scheduled for surgery that same week. Wild. Story 18. Patient here. My senior year of high school, during my AP Language Arts exam, I started getting an annoying tickle in the back of my throat. Didn't think much of it. The next day, Saturday, I'm feverish, congested, have a cough, and unable to stay awake for longer than 3 to 4 hours. Sunday was the same. However, Monday morning I woke up and felt much better aside from a persistent pain on the right side of my abdomen. My mom had made an appointment with our family doctor for that morning. Unfortunately, our doctor was on maternity leave, so I had a different doctor. The doctor said my pain was caused from an ovarian cyst that had either ruptured or was about to rupture. My mom insisted that it was my appendix. Doctor said that my white blood cell count was normal, therefore it was a cyst, and to give me ibuprofen. By Wednesday, my mom had annoyed the doctor with constant phone calls, so he ordered a CT scan. Nothing showed up on the scan, but the doctor said that he had called the emergency room at Primary Children's, and they had a room ready for me. He sarcastically told my mom, quote, maybe they'll give you the diagnosis you're looking for. 12 hours and 1 ultrasound later, it's discovered that my appendix is inflamed and leaking fluid into my abdomen. I went in for surgery 5 hours later. I was lucky my mom was persistent and didn't believe the doctor when he diagnosed me with an ovarian cyst. Story 19. Patient here. I have hypermobile Ehlers-Danlos syndrome, a connective tissue disease that caused all sorts of wild crap to happen in your body. I spent much of my life trying to be believed by doctors to get medical help. In the last 5 years, I've finally gotten a handful of diagnoses that I've had to figure out myself, find a helpful specialist to get diagnosed. I always go in hopes of ruling out the possible issues, and get treatment. I've been right about every weird diagnosis and am always proved right by test results and surgeries. So far, I've been right about my Ehlers-Danlos, dystonia, jury's still out on exactly which ones and how many, but likely POTS, MCAS, lipedema, endometriosis, adenomyosis, slipping rib syndrome, and now 6 different vascular compression syndromes. This afternoon, I got the call from a doctor about recent CT images confirming my concerns about Eagle syndrome. I think the wildest one so far is a tie. One is the left side rib pain I've spent years trying to figure out. Stumbled on sleeping rib, found a surgeon who knew it well, and he confirmed it within minutes of touching me. We did surgery, and my 10th rib was dislocating from my spine a little and slipping under the rib or 2 above it. Most of my doctors were shocked when I told them and showed them the surgical report. They didn't know a human body could do that and not have me screaming in their office. I have constant chronic pain. I'm used to it. The other was my median accurate ligament syndrome, or MALS. I told doctors for the last year that I believed I had it. I had every sign of it and even compression of my celiac artery on imaging. I finally found a doctor who was willing to investigate, and sure enough, my diaphragm was too low and was crushing my celiac artery and solar plexus. I also kept telling doctors I had something wrong with my diaphragm. He cut back my diaphragm a little and cut on the plethora of damaged nerves, and I've had so much less pain and GI issues than I did before. Story 20. Patient here. I've not had the best year health-wise. I could give you stories for days on this topic. Here's one. I woke up one day when I was staying over my boyfriend's house and started having severe allergic reactions. At first, I didn't realize I was having reactions because I don't have allergies. I thought I was sick. After a few times, due to pattern, I realized it was allergy-based. I made an appointment with an allergist. It took about 2 weeks or so to get in with that doctor. My reactions just progressively got worse, and my reactions were happening in the most random places almost every day. Wheezing, trouble breathing, heaviness in chest, swollen eyes, rashes, etc. I showed the doctor pictures of the videos of what I've been dealing with. He completely wrote me off, did not want to allergy test me. I had to ask 3 times to be allergy tested because he felt it wasn't necessary, and he told me I have anxiety. I asked for an EpiPen and inhaler due to my allergies progressively getting worse over the last few weeks. He reiterated that I just have anxiety and wrote me a script for Benadryl and sent me on my way. Not only was I allergic to everything he tested me for, but I left his office and 3 hours later ended up in the ICU. I went into anaphylactic shock driving home. Was rushed to the closest hospital, was given 3 EpiPens, and put on an Epi IV bag. I filed a complaint with the office and doctor. The allergist took zero accountability for writing me off. Fast forward, I've been hospitalized 4 times in the past year due to anaphylaxis and have been diagnosed with MCAS. I've found an amazing team of doctors who are helping me manage my symptoms, and I have recently started immunotherapy. Please advocate for yourself because no one else will. Find yourself a doctor who takes the time to listen to your 2 cents and is willing to follow up on that. Most importantly, always trust your gut. Story 21. I went to a walk-in clinic and told them I had a cough and fever. They said it was COVID and it would be just fine and I'd get over it. I didn't, so I went to see a real doctor and said I felt like I had pneumonia. He said it was just a cough and I was fine. I said I'd had pneumonia before and I know what it feels like. I told him that my asthma medication can make it sound like my lungs are better than they are, even if they're bad. But he still wanted me to wait a few days because he was so sure I was going to just get better. I got markedly worse, and I was just coughing so badly that I would just start throwing up. I bruised my ribs from coughing so hard. All I could eat was Olive Garden chicken and gnocchi soup. They sell it by the bucketful. Literally, you can buy a bucket of it. I came back in a few days and the doctor listened to my lungs again, but said he still didn't hear anything. I said I wanted a chest x-ray. He tried to talk me out of it by saying the price is I'd be paying out of pocket, but I knew I needed it. So they did the x-ray. Lo and behold, I had pneumonia and needed a shot in the ass, a course of 2 steroids, 2 different antibiotics that wrecked my gut microbiome, highly recommend yogurt and kombucha, and 2 calls to the billing department to sort out their double billing me. The doctor, to his credit, totally admitted that I had been right and was really nice. He fit me in every day for the worst of the pneumonia because I was dangerously close to being hospitalized. Probably should have been, but I didn't have insurance, so he could monitor me and make sure I was doing all right. I had a hospital bag ready to go, lol. Story 22. I started feeling a recurrent stabbing pain in my left flank, between abdomen and back, when I was about 6 years old. I had my first back x-rays made when I was 7 in 1978. I still have them. Nothing showed up. I lived a normal life, but every now and then I had those pains. My parents brought me to the pediatrician or the orthopedic who prescribed x-rays that showed nothing and stated they're just growth pains. The pains become worse when I hit puberty. They lasted for hours. I started throwing up a lot during those attacks. By the age of 15, they occurred almost weekly. The only medication that worked was Buscopan. My mother brought me to the umpteenth orthopedic, who wanted to talk to me alone and asked me why I made myself throw up, since I was such a nice girl. It was 1986. Here in Italy, we were just knowing about anorexia disease. But this time I had perused an anatomical table we had in a book at home and read the Buscopan leaflet before going to the doctor. No internet back then. So I asked him if it could be a renal disease instead. He laughed and said that if it was something in the kidney, I would have suffered a nightmare, but he prescribed me a renal ultrasound just in case. The ultrasound operator laughed as well. I remember it clearly, just a moment before touching the skin with the scan. Then stopped abruptly, went all white in the face, and told my mom she'll undergo surgery next week. She'll recover completely, though. Turned out I had a malformation since birth. The ureter wasn't straight, and my left kidney, swollen with 15 years of malfunctioning, was becoming necrotic. I underwent a 5-hour reconstructive surgery, stayed 1 month in hospital, gained a PA infection from the catheter, but made it home and safe. Story 23. I was the patient in the scenario. Super odd story. Now I'm about to start nursing school, but this was a few years ago when I knew basically nothing about the condition. I was pregnant with our first baby, and I had a normal, healthy pregnancy up until I'd almost reached full term, 36 weeks at that point. Of course, I was super uncomfortable, but just randomly started feeling weird. No pain or anything different about my baby specifically, but I just couldn't put my finger on it. An episode of Grey's Anatomy, I know, super unrealistic, kept popping into my head where a pregnant patient has pre-eclampsia and dies. Naturally, I googled the symptoms of pre-E, headache, visual changes, right upper quadrant pain, swelling, etc., and I had none of them at all. On the way back to my OB checkup after about a week of feeling off, I told my fiance, "You're gonna think I'm crazy, but I think I have pre-E." Of course, he said that was totally out of left field and reassured me I was having zero classic symptoms. Lo and behold, when we arrived, the nurse checked my blood pressure, pretty elevated, checked my urine, yep, high protein. They sent me over to the hospital for monitoring, and I was induced a week later due to pre-E. Intuition is a strange thing, lol. Story 24. Patient. Got told to eat more fiber by PA. Thanks, Margaret. Turned out to be a 9mm kidney stone blocking my kidney. Kidney was swollen 3 times the normal size. I'd been in and out for back pain over the years. Urologist pulled up the old spinal x-rays and said, "See, there's the stone. It was stuck for 4 years. At the beginning of COVID, fractured my humerus in 2, went to urgent care, referred to specialist and saw a PAC. Thanks, Kimberly. They put me in a Sarmiento brace, but didn't tell me I couldn't take it off or that it was supposed to heal with the brace. I would take it off in my sleep. I had to go to urgent care multiple times, once to ER. Nobody could deal with the brace, and they all said you're going to end up in surgery anyway. Finally went and sat in Doc's office and loudly refused to leave or, also loudly, to deal with Kimberly anymore because she was a liar. They finally scheduled surgery, 18 days after the injury. The doctor was a female dog and didn't let the anesthesiologist do a nerve block before I woke up. Said she'd have them do it if it was necessary. I woke up writhing on the table and they had to get a bunch of people to hold me down so the anesthesiologist could do the block. He was pissed. I remember him saying, "This is why we do it first." Story 25. One day I was drying off after getting out of the shower, and I noticed a hard mass under my right nipple. I'm a male. It felt like it was about the size and hardness of a lima bean. I asked my girlfriend to feel it, and she said she could feel it too. Of course, breast cancer is much more common in women than men, but this just didn't feel right. I went to my family medicine clinic and was seen by, apparently, an intern. She was in her early 20s and much younger than me. She seemed very inexperienced, and when I told her my concern, she looked at me very skeptically. When she examined me and palpated the area under the nipple, her attitude completely changed, and she said, surprised, "Yeah, there's definitely something there, isn't there?" So she booked me for an appointment to see an oncologist for the next day. I went to see the oncologist, an Egyptian guy in his 50s. He frowned quizzically when he read the intern's report, tossed the report on his desk one-handed, and said, "Okay, take your shirt off and let's have a look at you." The second his fingers touched the space under my nipple, he pulled a shocked face and his attitude completely changed. At the end of the exam, he said, "Okay, I'm going to book a biopsy for you right away," and left the room. I still remember him staring at me before he left the room, head tilted to one side, as though he was thinking, "How the F did you guess this?" Fortunately, it turned out to be nothing, but both the GP didn't believe me at first, and the specialist didn't believe me or the GP. From then on, I learned if you have something that you're genuinely worried about, it's okay to gently but firmly insist that it be checked out. Worried well phenomena be damned. Story 26. Not a doctor, but mum to a 7-year-old boy back then. Sorry if it's too long. He's a very active kid, a tough little guy who never complains loudly when he's bruised or in pain. So I got a call from his school that he fell from a hangling activity set they had on the playground, 2 meters. They had checked on him and he didn't complain much, but if I would pick him up anyway. With this activity set, they had a few incidents before of children getting hurt and breaking bones. They had always called an ambulance, but in this case, as he was pain-free, they didn't. I saw him. He was white in his face, and I knew immediately he had hurt himself badly. Went to the emergency room at the hospital because it was a Friday afternoon, as always when it's bad. I told the assistants in the waiting room, who'd do the triage several times during the wait, that he is hurt really badly and had broken something, and he needed to see a doctor immediately. They brushed me off. As he didn't make a fuss and only sat quietly exhausted next to me, they let us wait 3 hours, a 7-year-old boy in pain. When we saw the doctor, she pressed on his arm. He didn't react much, and she only gave him an x-ray because I insisted. She even said that there was nothing because a kid who had broken something would cry when touched. Half an hour later, she was quite flustered and told me he had broken his elbow and wrist. I'm still mad that he was ignored because I'm just a hysterical mom, and he was so brave. Story 27. My stepmom is an LPN, and she was able to diagnose my dad's heart condition and my thyroid condition. In January 2020, she got sick from her coworkers at the hospital and brought it home to my brother and dad. I didn't move back home until after I got furloughed from COVID, so I didn't get it. They all recovered, except for my dad. He randomly gained a bunch of weight, went from never sleeping to falling asleep mid-sentence. His snoring got worse. He seemed out of breath a lot. His legs were leaking fluid, and his anxiety got bad. She was immediately like, "I think COVID sent you into early heart failure." She took him to a few doctors who dismissed both of them. One finally believed he was having heart issues, but thought it was because of sleep apnea. She finally convinced him to go to the Mayo Clinic, and they were the ones who officially diagnosed him with early heart failure because of him having COVID. They also said he had a heart attack that summer that was missed. My dad wanted to give up a bunch of times, but because she kept pushing, his condition never got worse, and now he's a lot healthier. Then, when I was a kid, I was told I had a goiter when I had strep throat, but when I had lab work done, they said my thyroid wasn't going to be an issue until I was an adult. When I hit puberty, I started having a lot of issues. I slept in all the time. I would flop between depression and anxiety. My hair was falling out. I felt sick a lot. I got sick a lot because my immune system was crap and my brain fog was awful. My mom and dad were just convinced I was lazy, and my mom was even pushing for a bipolar diagnosis and tried to get me on bipolar meds. My stepmom came into the picture when I was 14, and she immediately called BS on all of that. She was furious with my mom for trying to push bipolar meds on me because she had never seen me manic or have any of the other symptoms. She said it was my thyroid, but my mom and dad wouldn't pursue it. My doctor didn't want to pursue it either. I ended up on antidepressants until I was 18. Stepmom never stopped pushing, and I was finally diagnosed with Hashimoto's at 19. We all tell her she missed her calling by not becoming a doctor. Story 28. Not the doctor, just want to give kudos to him. My mother had H. pylori treated years before my symptoms started. I was around 11 or 12 when they showed up in me. Got told to stop eating junk food, but I could eat the most bland food and still have symptoms. H. pylori is an infection that causes stomach ulcers, common in third world countries. Some strains aren't as symptomatic, but some make it feel like an alien chest burster is about to explode out. Eating hurt, not eating hurt. My PE teacher told me to sit out and eat saltines quite a few times because I was underweight in high school. I either avoided food or had no physical choice about throwing up. Was a Navy brat overseas during the worst of it, so there wasn't much choice in doctors. I had suggested, and my mother did as well, that I might have gotten it from her, but it took a while to present. I got told the pain behind my sternum and constant stomach problems were period cramps. Fast forward, about a decade later, after the first symptoms, a younger doctor actually looked at my blood work and my medical record. Big factor was iron deficiency. H. pylori can cause that and causes cravings for salt and pica habits, like chewing on ice and other non-nutrient cravings. A barium drink and imaging later, my stomach looked like Swiss cheese. A round of antibiotics is all it took. Damage was done, however. Esophageal sphincter is so worn down, if I get a little nauseous or heave, there are no brakes on the puke train. And I can never eat, or it just kind of climbs up my throat. But it doesn't feel like Freddy Krueger is trying to claw its way out. Sucks because I love cooking and eating. Just chew well and take my time. Don't get hunger pains either anymore. Just have to make sure I eat every so often before my blood sugar dips too far. Anyway, I still really appreciate that doctor that actually cared to even question my issues. He was also a military doctor, but stateside. But he gave a F, and I will be forever thankful. I was so blindsided by the fact he cared to look into it and found a solution, and I regret never getting his name. Story 29. Not a doctor, but I correctly guessed that my father-in-law had a drug-drug interaction when he passed out soon after taking a new antibiotic for an infection. His wife really doubted it because she was sure that if the drug was known to have interactions, the urgent care doctor wouldn't have prescribed it. They did tell him or her about the regular meds he took, and the pharmacy wouldn't have filled it. I asked the name of the drug, Cipro, looked it up, and sure enough, it's known to have interactions with the sorts of heart and or blood pressure meds he was taking. I made her promise to tell the ER doctor about my supposition. Turns out I was right. The cardiologist called the pharmacy and gave them a severe talking to, and told them they better not ever allow such a thing again. I used to work at a pharmacy years ago, and even then, drug-to-drug interactions would pop up on the screen as we ran prescriptions through the computer. I'm not sure how the pharmacy overlooked my FIL's interaction, but maybe the system flags a lot of mild interactions, and people just got used to ignoring and overriding them as they didn't notice this was a real and major interaction. Story 30. I'm a patient, and I hope my post helps someone, as I had been misdiagnosed for years. I was experiencing difficulty with random severe nausea, urinating, fecal movement, swallowing, breathing, almost passing out, heat intolerance, feeling like my head went on a roller coaster ride without my body, and small fiber neuropathy. I had seen so many doctors I actually lost count. Some doctors said it was in my head, some suggested I see a therapist, some did not attempt to diagnose me. I was accused of faking pain, etc. It was overwhelming and depressing. Through a series of mistakes made by my PCP's assistant, I saw a specialist at Stanford. OMG, I will be forever grateful for her error. After even more tests, I was told that I probably had a rare autoimmune disease called AAG. I was referred to a doctor who specializes in AAG. It was confirmed that I have serogenerative AAG, and that is the underlying cause of my gastroparesis, dysfunction from mouth to anus, heat intolerance, almost fainting, small fiber neuropathy, exhaustion, etc. Approximately 200 people per year are diagnosed with AAG, of which 50% are serogenerative. I'm fortunate that I was diagnosed correctly after years of being ill. Story 31. Not a doctor, but a patient. A year ago, I found out I was pregnant. I was barely 9 months postpartum with my first, and my husband and I were trying again. I was barely 5 weeks along when I realized I was pregnant. I'll never forget peeing on the stick and then delivering the news to my ecstatic husband. After he had his initial celebration, I said, "Listen, I'm really happy for us too, but it's early, and I just have this feeling something might happen." I couldn't explain it, but I just had this nagging feeling something was wrong. I had also articulated when we started trying that I didn't think things would be so easy this time around. My husband was a little miffed when I rained on his parade, but eventually told me he was nervous too. Fast forward a couple weeks, I have my first OB appointment scheduled for Tuesday. It's the Thursday before. I'm driving home from a big work event, and I just cannot get rid of his literal voice in my head saying, "You're going to be one of those women who has a miscarriage." I'm not a super religious person, but I said a prayer aloud that didn't want to bring a gravely sick baby into this world. I asked the universe to take the baby now if that was the case. All the while, I had this vision of an unhealthy, weak, sick little baby. It was so strong of a feeling, and the vision was crystal clear. I got home 20 minutes later, said hello to my husband, and promptly started bleeding. We confirmed a miscarriage at the Tuesday appointment. I also had a very surreal experience while miscarrying at home, where I believe I felt the spirit of my baby literally say goodbye to me as it left my body. It felt so strongly like a boy, and it felt so sick and unhealthy. I can't quite explain it. It's like I could feel that this baby wasn't meant for Earth. I still cry thinking about it. Right now, as I'm writing this, I'm holding my healthy, happy, 6-week-old baby boy. Miracles happen. I was so nervous during his pregnancy, but knew in my gut he was going to be okay. Although, again, I had strong intuition from the start that birth wouldn't be easy. After a breeze of a pregnancy, in the last weeks I had some wild symptoms and situations, and ended up being induced for fear I was developing pre-eclampsia. Always trust your gut. Well, OP, I'm pretty sure that this was very hard to type up and share, but definitely appreciate it. That's an amazing story and testimony, and yeah, I totally agree. Trust your gut. Story 32. I slipped on some cardboard at home and did a sort of sitting fall. Not serious, and I wasn't hurt in the slightest. Over the next few days, my ankle/foot area started to hurt, like a muscle ache. It got worse over the next week or so and felt better at rest. Eventually, I was convinced I had somehow fractured my foot or ankle. The pain felt deep in the bone for me and not in the muscle. I do the obvious thing and go to a walk-in center for minor injuries. They dismiss it as a mild sprain, despite me injuring it weeks before and it not getting better with movement. Doctor prescribes exercise and a support sock, which caused me so much pain when wearing it, I cried. Went to the emergency at hospital a couple days later to get an x-ray. It showed no breaks, but they only scanned my foot in one position. Doctor there said if the support sock was uncomfortable, I should buy a bigger size. Didn't listen to me when I said I wasn't in discomfort. I was in extreme pain. A week goes by and I'm in agony. I visit urgent care again to get another opinion, immediately dismissed and looked at like I'm a crazy person. I go to the walk-in again for another opinion. The nurse there was so rude to me she refused to do an examination and told me that stress fractures didn't exist. Wrote in my notes that I was convinced I'm walking around on a broken foot. By this point, I'd had a private physio done, whereby they told me it wasn't muscular and I should get an MRI done. I did so, privately. I'm in the UK, so all my previous appointments about this particular issue were through NHS. When I told the walk-in nurse this, she told me there was no way I had a broken ankle because the MRI scanning would have told me. Right away, I didn't have a break, even though MRI scanners aren't qualified to tell you the results there and then. The private MRI came back. I had an acute fracture of the heel bone. NHS doctors tried to deny wrongdoing by stating I'd needed an x-ray in a specific position. Or, they could have just effing listened to me in the first place when I said I was in so much pain I felt sick. I was indeed convinced I was walking around on a broken foot, and I was right. Story 33. About 4 years ago, I started having crazy stomach issues. Anytime I ate something, I'd either throw up or have to run to the bathroom almost immediately. My primary doc thought it was just a stomach bug and gave me nausea meds. After a couple of weeks, he sent me to a GI specialist. A couple months go by, and I've now lost about 40 pounds, have absolutely no energy, and am in pain all the time. I could only eat a couple bites of a few safe foods at a time. The specialist has done test after test, and I said I just have irritable bowel syndrome. I kept asking him about my gallbladder. I had all the symptoms. One night I wake up with pain/pressure in my chest and I couldn't feel my left arm or hand. I was taken by ambulance to the ER and monitored in the cardiac unit. Everything checks out okay with my heart. I tell everyone who will listen about all the recent stomach issues and it could be my gallbladder. Still, everyone says it's not that. I finally see a different primary at the same office because mine was out for vacation. She sent me to a surgeon right away and she agreed to do surgery. When I woke up from anesthesia and see them, he said I had the most inflamed gallbladder he'd ever seen. He had no idea why it never showed up on my scans. Also, turns out a gallbladder attack and a heart attack have a lot of the same symptoms. Also, I wanted to add that if you have a feeling of overwhelming dread and feel like you're dying, don't blow it off because a doctor says you're fine. Get a second, or third, or fourth opinion. Big thanks to an urgent care doctor that told me if your body's telling you that out of nowhere, to listen to that feeling. Story 34. Not a doctor, but about 6 years ago I had my gallbladder removed. About a year and a half after that, I had what felt like more gallbladder attacks. I had pain in the same spot and vomiting. Went to the ER and they ran a slew of tests. Nothing showed, so they sent me home. 2 days later, I went back to the ER because at that point I started living in my bathroom at home. No joke. I couldn't leave because of the vomiting and pain. Same test as the first time, still nothing showing. Sent home again, made an appointment with my doctor's nurse practitioner because now I had started to go jaundice. I asked him about my eyes and the possibility they didn't actually remove my gallbladder. He laughed at me and said, quote, "Everyone's eye whites can vary, even though mine never looked like that, and I was paranoid." Said I had an ulcer and sent me on my way. The medicine for the ulcer never helped, and after 2 weeks, I was still living on my bathroom floor. We went back to the ER for a third time, ran the same tests, and I was nearly septic this time. They ordered an ultrasound, and I was half right. While I thought maybe they didn't actually remove my gallbladder, it was actually a stone stuck in the bile duct. Had a stent placed, and after 3 days of heavy antibiotics via IV, was finally sent home feeling so much better. Story 35. Not a doctor. Went to my doctor at the age of about 17 and said I thought I was autistic. She referred me to a mental health link worker whose job it was to do a brief screening and point you towards the right team for your particular issue. He said I couldn't be autistic because I had a job and a relationship. I continued feeling like I was broken for another 5 years. I started working in a nursery and all the autistic kids were magnetically drawn to me. My manager said that since I spent all my day with the autistic kids, I should do training. I found it all really interesting and did course after course after course. The more I learned, the more I knew I was right. 5 years after my first referral to this crappy dismissive link worker, I found myself in front of him again. I absolutely buried him under technical terminology and evidence. He was pissed. Eventually, he grudgingly pulled a questionnaire out of a folder and asked me to rate how much I agreed with the statements on a scale of 1 to 5. Only took about 10 minutes. He tallied up the results. Okay, I'm going to refer you to the autism diagnosis team. It's been a decade and I'm still furious he didn't do the questionnaire at our first meeting. I would have known I was just different instead of broken. I also don't think you should have to become a professional in something to be able to get diagnosed with it. Story 36. I tore the small head off the bicep from the radial head, while letting my 40-pound puppy slide down my arms to the floor. Instant pain, but eased over an hour or so. I did some Google foo, based on my 20 years working in physical therapy, office knowledge, and came up with what I most likely tore. This was a Saturday night. On Monday, I dropped into the PT department and had one of the PTs take a look at it. He asked what I did. I said, I think I tore off the short head of the bicep. He looks at me and asks, how? I describe it, and he's shaking his head like, no way. That would not cause that injury type. He does his thing and checks it all out and looks at me and says, you're right, better go see the ortho. The first ortho urgent care kinda poo-pooed me, but ordered an MRI just in case. Very small fragment holding on, but consider it a complete rupture for the report. The actual surgeon after that says, I'm sure it's torn, but just can't be complete. Still too much strength and movement possible. It was still hanging by a thread, thankfully, and hadn't begun to retract. As that was what I worried about, because it was taking so long to get each appointment scheduled. Every doctor asked, how did you do it? And each one said, this usually happens to men in their 40s lifting heavy weights. I just kept repeating, I know. 60-year-old female not lifting anything at all, just hyperflex the elbow. Story 37. I'm a patient, not a doctor. I've been having issues for over 15 years with my weight, my skin, my hair, fatigue, etc. I originally asked a NP at my old GP office if she could run a test on my thyroid because I was having so much trouble losing weight while eating barely 1,200 calories a day. She suggested that I stop lying to myself about what I was eating and try harder to lose weight. Rinse and repeat with every doctor regardless of why I was at the appointment until my last one. We've been keeping an eye on my thyroid, but the levels remain barely within normal range every year we did the blood work panel, but at least she listened. Then she sent me to an ENT for an unrelated issue, and he noted that my thyroid was quite enlarged. Several scans and a biopsy later, I have thyroid cancer, likely caused by Hashimoto's. Hashimoto's is an autoimmune disease where your body attacks your thyroid and causes nodules, some of which can develop into cancer. It also causes intermittent bouts of hyperthyroidism, which 100% explains every symptom I complained about to the original NP, including how inconsistent my problems were. Hey, MP Marge, I'd like to present you with this giant FU. I was right. To all doctors, when a woman shows up with a problem, don't ask her if she's actually tried to lose weight. Is your first response to her concerns? For F's sake. Story 38. In June to July of this year, I started having a lot of migraines, 3 to 4 episodes a week. They weren't disabling, so I just got on with my life. A few weeks later, I noticed that my Leica, my 10-month-old dog, was licking my forehead and sometimes trying to dig my head. Found it a bit weird, but found it funny and just continued my life. I asked my doctor to do some tests on me. I got on a fairly long waiting list. He didn't expect to find anything. Almost 1 month ago, I ended up in the ER because of a migraine that almost kept me from breathing. I was examined and an emergency CT scan showed something abnormal in my brain. I was referred to a specialist hospital where the MRI showed a growing brain tumor, very near the area where my dog was trying to dig. Last week, she also alerted me, barking at me and biting my legs, to my first epileptic seizure, something that the neurologist warned me would be a consequence of the tumor. I started treatment for the tumor quite early, and she's going to be an excellent medical assistance dog. Story 39. As a patient, I got some crazy rash. I was red all over my body. Nausea, not being able to eat, higher temperatures / occasionally fevers, and just felt like crap, or how I describe it. I felt like I had something toxic or poison in my system. Doctors told me it's an allergic reaction to antibiotics I took a bit before that, and I should just wait it out. It'll pass on its own. I wasn't having it. I was convinced it's more and started doing blood tests on my own with my mom's support. Due to that weird feeling, I decided to test liver stuff, because that's what metabolizes toxins, etc. Turned out I had liver injury, borderline liver failure caused by said antibiotics. Like, blood tests had been rapidly getting worse, 1 day difference, and already everything was twice as high. Liver pretty much was not working at all. If I waited it out for like a few days more, I would have needed a transplant, 100%. Due to my weird feeling, it was still possible to save without transplantation. So I did kind of get poisoned by having antibiotics twice in a short period of time. It's hard to explain in English, but just my weird feeling was right, and mine and my mom's persistence saved me from some pretty serious crap. Story 40. Not a self-diagnosis, but Dr. Google is not always wrong. I was sitting on my sofa one Saturday morning and went totally deaf in my right ear. Not that sort of loose hearing for a few seconds and it comes back thing, totally deaf. Since it was a Saturday, I Googled it and it said to have it checked out ASAP. I tried to get an appointment right away with my GP on Monday and explained what happened and I should be seen ASAP. They dismissed me and said, see you in 2 weeks. When I finally got in, he wasn't convinced it was anything. I asked to be referred to an ENT, ear, nose, and throat doctor. Saw her, and she said, you should have been seen ASAP. Sudden hearing loss can be very serious if not treated immediately and may not come back. Hearing tests proved hearing loss. I was put on a high dose of steroids for 3 to 4 weeks and told to recheck the hearing test. Most of my hearing came back, but not all. It was idiopathic, no known cause, after x-rays, etc. The audiologist told me after my second hearing test that I was very lucky the patient just before me had something similar happen, and he did not recover his hearing at all. Never wait on hearing loss, no matter what they say.